My thalassemia and liver complications, my transplant experience after 10.5 years. Where can you have a liver transplant in the UK? Well, there are 7 hospitals in the UK with adult liver transplant units, 2 of them in London, which are the biggest in the whole country, but they're all free and Kings, but there is also in Birmingham, Leeds, Newcastle, Cambridge, and Edinburgh. The criteria for a liver transplant: in order to be eligible for a liver transplant, you must have chronic irreversible liver disease, irreversible being the key word here, that has not responded to other medical or surgical treatments. You must qualify for and be able to tolerate major surgery. How long is the waiting list for liver transplants? Well, an average waiting time for liver transplants in England is 149 days for adults and 86 days for children. Being on the waiting list may predispose you of anxiety and depression. It was found that 1 in 4 people waiting for liver transplant have symptoms of moderate and severe devere The odds of survival. According to the study, people who have a liver transplant have an 89% chance of living after 1 year, which is reasonably good. The 5-year survival rate is 75%, which therefore means that I'm doing exceedingly well, 10.5 years. A problem liver. What is a problem liver? Well, in order to be even talking about a liver being a problem, it has to be with decompensation, cirrhosis, cannot be propped up indefinitely. Unlike the kidney and the heart, the liver cannot be kept going artificially. Eventually, it will fail completely. Unless a transplant is performed, the patient, unfortunately, will die. Why did I need a liver transplant? Well, basically, my iron overload due to my many blood transfusions to treat my thalassemia started damaging my liver. And then to top it all up, I was infected with hepatitis C during the importation of infected bloods in England between 1974 and 1980. They tried to cure prior to transplant, many different protocols, and it started off with interferon injection for very many months, but it didn't work. Then interferon became percolated interferon, so we tried that again for many months. It didn't work. Percolated interferon, then with ribavirin, that was tried again with many months. It didn't work. They tried that again after a break, but again it didn't work. And finally, the newest protocol was percolated interferon, ribavirin, and telaprevir for many months again, but with no success. The side effects of those treatments, interferon injections, are very, very nasty. It makes you feel like you have the worst cold in your life, with fevers, shivering, headaches, big fatigue. You want to sleep all day, and of course, total loss of concentration. Ribavirin is even actually worse, especially for a thalassemic, because of its hemolysis side effects, which due to my thalassemia, instead of having 2 units every 21 days, I had to have 2 units every 7 days, more or less 3 times the amount, which meant that my iron control was totally disrupted. The treatment prior to transplant I developed hepatocellular carcinoma. Therefore, they tried to ablate the tumor in 2012. Recurrence of HCC in 2013. Again, trying to control it with ablation. But a repeat ablation late 2013 was not possible. So I was put on the liver transplant list. In order to get on the transplant list, many assessments have to be made, many blood tests and so forth. This is a list of them, of everything they have to check: blood clotting, heart functions, lung functions, liver functions, kidney functions, virology, cancer markers, CT scans, alcohol levels, bone density, arterial blood vessels tests, which is actually one of the most important parts of it, and so forth. And at the end, a whole list of people who will be involved at the transplant theatre have to also look at you and evaluate you. And this is the list of them. The anesthesists, the nutritional, the social workers, the psychological evaluation, which is considered to be very important. And of course, a family consultation, due to the fact that the family of the patient would be very much involved in his well-being. The waiting list, there are two lists in England, the central UK list and the hospital list, and you are on both, and it's a priority of both that you are then called to go in. You must stay in the country while you're on this list. You cannot go anywhere. Thank God my waiting lasted 11 months until the morning of the 24th of June 2014. After the transplant, this is what you look like when you come out of the theatre. Lots of tubes, lots of bags, lots of drainage, lots of cannulas and so forth. Not a pretty sight. Thank God I didn't see it. I was sedated. What went wrong with my transplant? Unfortunately, yes, it was not a garden of roses. I had a collapsed hepatic artery, which needed a stent to correct the problem, which unfortunately was not successful, because during the procedure with the radiologist punctured my duodenum, therefore required a second surgery to reconstruct the bile duct. I spent 37 days in the hospital, which was rather a long time. This is the diagram of a liver anatomy. I'm sure you are all familiar with it. This shows where all the pipes that go into the liver to take things in and to take things out, all those have to be cut, and the new liver coming in will connect to all those pipes. Unfortunately, I am on a tremendous amount of medication. For my thalassemia, I have to have blood transfusions. I have to have iron chelation to remove the excess iron. I'm diabetic, therefore I'm on insulin, injections. I have a heart problem, which requires a certain amount of control. And of course, my liver transplant requires immunosuppressants, tacrolimus and azathioprine, which of course create other problems. For example, infections, because they reduce your immune system, and I had quite a few of those. September 14th, I was with an infection in the hospital for 25 days. December 15, urinary sepsis 2 days. January 16, infected for 6 days. Most of them, all these problems are basically due to the immunosuppression. And the final one was in September 2017, an infection and bleeding, internal bleeding, which lasted 20 days in the hospital. It's not easy, but you have to persist. And I'd like to say thank you. In my thank you, I would like to give a very big thanks to the doctors at the Royal Free and the Whittington Hospital who are fighting to keep me alive. Thank you very much.